Absolutely, Frank. You know, we talked earlier in the week about BayCare's effort to focus on health and wellness and not just sick care. Today we're bringing back Steve Mason, CEO, and talk further about the innovations that BayCare is making to deliver health care. Steve Mason, CEO of BayCare, welcome back again. Good to have you again.
Well, thanks,
You've
Kathy.
become kind of a regular here on Front Row Tampa Bay. Today in this segment, you and I want to talk a little bit about the healthcare system, in your words, correcting itself and changing. You and I were just talking a couple of minutes ago, but upstairs here, there's a media hub where young people 25 and under, speaking a different language, looking at all the technology, tweeting, Facebooking, you know, that is their culture. They are digital natives. In healthcare, you said to me, you know what, you and I, Kathy, are still thinking about healthcare the way our parents thought about healthcare. And how is that?
Yeah, I often marvel because, you know, we're such a diverse community, but we're also diverse generationally.
Yes.
More so than we were with our parents, because, you know, like my parents, I go to a doctor, I ask him to help me find out what's wrong with me and help figure out how I can get better. My 22-year-old daughter, she goes online, diagnoses what's wrong with her, and goes to find a doctor to validate her diagnosis. If she doesn't like that, she'll try to find another one.
You're absolutely right. So generationally, how are they viewing healthcare?
Well, they want to be involved, but they have information that we never had.
Right.
You know, I marvel at the telephone. She's got a telephone in her apartment. She has one that she's never a foot and a half away from. And I call and call and call. She never answers the phone. They communicate by texting. They don't use the phone like we use the phone. So as we begin to look at the advancements that are going on in the social media space, that's going to have a huge impact, I think, on how people feel about how they want to use healthcare, around convenience, around getting their questions answered, around being able to pay bills in a much more convenient way than the archaic process that we use through most of our insurance activities now. So all of us have to be able to really upgrade what we're doing, get into that technological space, and be able to answer and address the experience that the patient is looking for. Otherwise, you'll be punished. Because if you can't provide the kind of convenience and the information and the involvement, people will seek out organizations that can.
Well, yes. I mean, people go online now, and what's the health grade of my doctor before I go? What's the health grade of my hospital before I have a tonsillectomy? Am I going to trust that hospital? The internet says, I'm not sure I like this man or woman.
And that's a great point, because we've become much more transparent in terms of how the doctor is practicing, what's going on in the hospital. About 3 or 4 years ago, for example, on our website, there's a Q, and right next to the gold Q for standing for quality, there's a link, and if you push the link, it tells you everything that we report to the federal government, to the state of Florida, the Joint Commission on Hospital Accreditation, to ACA, and other things that we're working on to try to improve what we're doing as a part of our quality improvement program. We started that because we realized we needed to tell our own story. I can go on the internet now and find at least 9 sites that are rating us. We have no idea what data they're using to rate.
Right.
Healthgrades.com and Yelp. Yelp was originally formed to rate restaurants, and now they're rating everything.
I mean, it's weird that you have to compare a surgical procedure to a hamburger. Yeah, I like it, I don't, it's an A, it's a B. I mean, what a weird world you're in the terms of healthcare is now also at the whims of what people are saying in terms of technology, and you have to respond to that.
I mean, we have to look at it not as good or bad, but as different. And how do we try to get ahead of the wave in the process? And then how can we use technology to get at improving health? Because our mission at BayCare starts out, BayCare will improve the health of the people that we serve. We've always been in the health business. Now we have significant number, 11 hospitals, a very large hospital delivery system, and that's really in the healthcare business because most of the people we're providing services to are ill or need surgical procedures. It's the health business that we need to get focused on, and I think that the social media generation that's growing up and our technological capabilities are going to help all of us understand how to address and deal with healthcare reform. We've been working on that for 3 years, and we're coming up shortly with a consumer portal that helps people communicate back and forth between their physician and the hospital and be able to get information, educational information. We do 1,000 educational programs a year, and those are in a whole variety of different areas, 13 different areas. We have an opportunity. You may have seen some of the signs that the billboards, 7 minutes could save your life.
7 minutes, right?
Taking us to a website that helps us identify risk factors in our own health.
Yes, I did go on your website, and all these the latest research articles. I thought, well, I'm interested in that family history and genetics as predicting heart disease, and I clicked on it and read it and thought, wow, I didn't know that. I mean, that's one of the ways that healthcare institutions are not just treating sick people walking in the door, but pushing out information that says, hey, maybe I should think about my diet. Maybe that's something I need to know. You're giving me information, and as a consumer, I'm consuming it, and you and I are interacting in a way that seems really positive for your brand.
And to a large extent, that's how the cost of healthcare will come down. I mean, I think employers, all of us that are customers of healthcare, believe that the cost needs to come down. The way we need to do that is we have to think more about taking more responsibility for ourselves to be sure that we understand what's going on, we understand what we might potentially get involved in. If we have a family history, for example, with diabetes, we need to pay attention to that before we become a diabetic and begin to think about the dietary changes. Otherwise, we'll get into this very expensive health care, and it changes the quality of life for many people. So we're really advocates of people learning more about our health. We've got a real childhood obesity problem in the market.
Which is very costly as well.
Oh, it absolutely is. It's costly not only in dollars, but the biggest cost is what it's doing to the bodies of these children, because diabetes has potential problems with organs and eyesight and a whole variety of other medical problems. And we've got a generation that might not outlive their parents because of this issue. And I think the important thing is that as a community, we need to put our arms around that. The school system, the health system,
Absolutely.
The physician's office, the pediatrician's office, the legislature, all of us that are concerned about Floridians and concerned about having a very prosperous economy, need to make sure that we've got a healthy economy and a healthy workforce and healthy lives, healthy families.
One last quick thing. I know that you think that the fee-for-service model is going to die a slow death, that something will replace it, the fee-for-service model. We're going to have a new way of hospitals being paid and doctors being paid in the future, regardless of what happens with healthcare.
Yeah, to me it's fairly basic. We get paid for doing things in the fee-for-service. It's a transactional business. The doctor sees a patient in the office, gets paid, does a procedure, gets paid. The hospital does procedures, does a CAT scan. We get paid for those things on a transactional basis. It's Einstein's old definition: keep doing what you're doing over and over and expect a different result. We're not going to get a different result. We're going to get the cost driven up by that kind of a model. So we've got to change the model. In the movement, regardless of where the politics are and where they end up, I think reform has to occur because of the challenge that employers are having, that all of us are having with the cost. So as we move in that direction, the answer to us is managing populations and looking at these things that are called bundles, where you're paid almost like an insurance premium, where the hospital and physician would be paid an amount of money, and that amount of money they would use to help keep somebody healthy. Because they're not getting paid to help them keep people healthy, we need to figure out a way to incent physicians, who are the ones that write the orders for all the delivery of care, incent physicians to do that.
Steve Mason, fascinating, and as always, good to have you here.
Good to see you, Kathy.
I've enjoyed having you this week on Front Row Tampa Bay. All right, coming up next, a Front Row Tampa Bay discussion on how innovation and partnerships are fueling Tampa Bay's economy.